Are you wondering if investing in erectile dysfunction treatment is still worth it now that you and your partner are done having kids? Join us as we explore the emotional and practical aspects of addressing erectile dysfunction in relationships where childbearing is no longer a concern. From reigniting passion to strengthening emotional bonds, discover why ED treatment could be a game changer for you and your partner. Stick around to the end to gain one more helpful insight as to why ED treatment could be good for you. Today, I'm going to be discussing ED treatment and answering all of the questions you've ever had. I'll be talking about how it works, what it does inside the body, why you should still get the treatment if you are no longer having children, and more. The chapters of this video are in the description in case you wanted to skip to anything. Don't forget to like and subscribe for more content like this. And let me know in the comments, what's your opinion of ED treatments? Would you ever get them? Why or why not? Have you had them? I'd love to hear your thoughts and your experiences. So how does ED treatment work? Well, erectile dysfunction or ED treatment works by addressing the underlying cause of the condition, which can vary from physical to psychological factors. So here's an overview of common ED treatment options and how they work. First, oral medications. Phosphodiesterase type 5 inhibitors, or PDE5 inhibitors, are medications like sildenafil, also known as Viagra, tadalafil, also known as Cialis, and vardenafil, also known as Levitra. These are often the first lines of treatment when it comes to ED. They work by increasing blood flow to the area, which helps achieve and maintain an erection. These medications are typically taken on an as-needed basis just before sexual activity and require sexual stimulation to actually be effective. The second thing is lifestyle changes. Sometimes ED can be improved or even resolved by making simple lifestyle changes, such as quitting smoking, reducing alcohol consumption, maintaining a healthy weight, exercising regularly, and managing stress. These changes can help improve overall cardiovascular health, which is closely linked to erectile function. The next is psychotherapy. In cases where psychological factors such as stress, anxiety, depression, or relationship issues contribute to ED, psychotherapy or counseling may be beneficial. Therapy can help address underlying emotional issues and improve communication and intimacy between partners. The third thing, vacuum devices. And everybody laughs at this. That's not mine, baby. Vacuum erection devices, or VEDs, are non-invasive devices that create a vacuum around the penis, drawing blood into the penis to produce an erection. A constriction ring is then placed at the base of the penis to maintain the erection during intercourse. Penile injections. Intercavernosal injections involve injecting medication directly into the side of the penis. Things like Bimix or Trimix cause the blood vessels to dilate and increase blood flow, leading to an erection. Common medications used for penile injections include alprostadil, PRP injections. PRP injections, such as the P-shot, can be injected into the corpus cavernosum of the penis, improving blood flow and helping regenerate tissues and nerves, leading to more effective erections. Penile implants. For individuals who do not respond to other treatments or prefer a more permanent solution, surgical placement of a penile implant may be an option. Penile implants are devices implanted inside the penis that allow for on-demand erections. There are inflatable and semi-rigid types of penile implants. In some cases, ED may be linked to hormonal imbalances such as low testosterone levels. Hormone replacement therapy may be prescribed to address these imbalances and improve erectile function. The effectiveness of ED treatment varies depending on the underlying cause of the condition, as well as individual factors such as age, overall health, and lifestyle. It's essential to consult with a healthcare provider to determine the most appropriate treatment specific to your situation. So how do you know if you're a good ED treatment candidate? Determining whether you are a good candidate for erectile dysfunction or ED treatment involves several factors, including your medical history, the severity of your symptoms, and any underlying health conditions. Here are some indicators that you may be suitable for ED treatments. Number one, consistent symptoms. If you have experienced ongoing difficulty achieving or maintaining an erection sufficient for sexual activity, it may indicate a need for ED treatment. Occasional episodes of erectile difficulty are normal, but persistent or recurrent issues may warrant intervention. The second is health status. Your overall health status is an important consideration in determining your suitability for ED treatments. While ED can occur at any age, it is more common in older men and those with certain medical conditions such as diabetes, cardiovascular disease, high blood pressure, or obesity. Managing these underlying health conditions may improve erectile function and enhance the effectiveness of ED treatment. Willingness to seek help is also important. If you're open and willing to seek help for ED, it is an essential factor in determining candidacy for treatment. Many men feel embarrassed or reluctant to discuss their sexual health concerns with a healthcare provider, but addressing ED early can lead to better outcomes and an improved quality of life. Certain medical conditions or medications may contraindicate specific ED treatments. So, for example, individuals with severe heart disease or those taking nitrates for chest pain should not use the PDE5 inhibitors such as Viagra or Cialis due to the risk of dangerous interactions. Your healthcare provider will assess your medical history and current medications to determine the safest and most effective treatment options for you. Lastly, if ED is causing distress or negatively impacting your self-esteem, mental health, or relationships, you could be a great candidate for treatment. Addressing ED can help restore your confidence, enhance intimacy, and improve your overall well-being. But it's important to have realistic expectations about the outcomes of any type of ED treatment. While many men experience significant improvement in erectile function with treatment, it may not be effective for everyone. Your healthcare provider can help you understand the potential benefits and limitations of different treatment options. Ultimately, the decision to pursue ED treatment should be made in consultation with a healthcare provider who can assess your individual situation, provide guidance, and tailor your treatment plan to meet your needs and preferences. So, what are some of the results possible with ED treatment? Well, first, improved erectile function. The primary goal of ED treatment is to improve erectile function, allowing for the achievement and maintenance of erections sufficient for sexual activity. Many men experience significant improvement in their ability to achieve and sustain erections with appropriate treatment. 2, enhance sexual satisfaction. Restoring erectile function can lead to increased sexual satisfaction for both the individual and their partner. The ability to engage in satisfying sexual activity can improve intimacy, communication, and overall relationship quality. Addressing ED can boost self-confidence and self-esteem, reducing feelings of inadequacy or embarrassment related to sexual performance. This can have positive effects on mental health and overall well-being. The next is improved quality of life. ED treatment can significantly enhance overall quality of life by reducing stress, anxiety, and frustration associated with erectile difficulties. It allows individuals to regain control over their sexual health and enjoy a more fulfilling sex life. Along with that, you will also have positive psychological effects, including decreased symptoms of depression, anxiety, and relationship strain. Improved sexual function can lead to greater feelings of happiness, contentment, and overall life satisfaction. As a result of that, you will have enhanced relationship dynamics. Addressing ED can improve communication, intimacy, and emotional connection between partners. Couples may experience greater closeness and satisfaction in their relationship as a result of improved sexual function. This can help prevent the occurrence of relationship issues. Left untreated, ED can contribute to relationship problems, including decreased intimacy, communication breakdowns, and decreased relationship satisfaction. Treating ED early can help prevent or address these issues before they escalate to the next level. So what are some of the other potential health benefits? Well, in some cases, addressing ED may also have secondary health benefits, such as improved cardiovascular health. ED can be a warning sign of underlying health conditions such as diabetes, heart disease, or high blood pressure. So treating your ED may also help managing these conditions and reducing associated risks. So is ED treatment actually worth it if you're done having treatment? Yes. Pursuing erectile dysfunction treatment can still be worth it even if you're done having children. While the ability to engage in sexual activity is important for procreation, it's also a crucial aspect of overall health and well-being, as well as intimate relationships. Here are some of the reasons why ED treatment may still be beneficial even if you're done having kids. The first, quality of life. Erectile dysfunction can significantly impact your quality of life, leading to feelings of frustration, embarrassment, decreased self-esteem. Addressing ED can help restore that confidence, improve your self-image, and enhance your overall well-being. The second is those intimate relationships. Sexual intimacy is an essential component of many romantic relationships, regardless of whether children are desired. ED can strain relationships and lead to communication difficulties and emotional distancing. Treating ED can help foster greater intimacy, trust, and connection between partners. The third, personal satisfaction. Sexual fulfillment is a fundamental aspect of being human. This will contribute to a feeling of happiness, fulfillment, and vitality. Addressing ED allows you to enjoy a satisfying sex life and experience the physical and emotional benefits of sexual activity. Along with that, physical health is incredible. Erectile dysfunction can sometimes be a symptom of underlying health conditions like diabetes, heart disease, or hypertension. So treating ED may help identify and manage these conditions, leading to better overall health and reducing the risk of associated complications. It can also help mentally. ED can have significant psychological effects, including increased stress, anxiety, and depression. Treating ED can alleviate these symptoms and improve mental well-being, leading to a better overall outlook on life. Ultimately, the decision to pursue ED treatment is a personal one, based off your individual values, priorities, and goals. If regaining sexual function and improving overall quality of life are important to you, then pursuing treatment will be worthwhile, regardless of your reproductive plans. So let's talk about a bonus. Left untreated, ED can contribute to relationship problems, including decreased intimacy and communication breakdowns. Addressing ED early can help prevent or address these issues, leading to healthier, more satisfying relationships. Couples may find it challenging to discuss ED openly and honestly, leading to communication breakdowns and misunderstandings. One partner may feel embarrassed or ashamed to broach the topic, while the other may feel hurt or rejected by the lack of sexual interest. Without open communication, issues related to ED can fester and contribute to resentment and conflict in the relationship. But with ED treatment, all this can be avoided. Well, there you have it, your in-depth guide to ED treatment. If you still have any questions or concerns, comment them below. I'd be happy to answer them. Interested in exploring ED treatment for yourself? Click the link in the description to book a consultation with one of our experts. Don't forget to like and subscribe. Enjoy your vacations, and we'll see you next time.